Good morning, and thank you for joining us. I'm Amanda Marti from Delta Orthopedics, and today I'm joined by physician assistant Jose Marti to talk about common injuries and treatments in the face of a car accident. As always, please leave any questions or comments in the chat section, and we'll be sure to answer them during the segment.
Hello.
So, how's it going, Jose?
Going pretty good so far. Thank you for having me again. Thank you for joining us.
Yeah.
Good stuff.
Okay, so let's just jump right into the first question. So the first question we have is, are injections a Band-Aid for my injury?
Yeah, so that's a great question. I get that question a lot, and this is what it comes down to. It really depends on what the issue is. I often get it, the question when it comes to herniations and such like that. And this is bottom line: if the structural change or the herniation in the neck, mid back, lower back is big enough, okay, the injection, whatever it may be, it doesn't matter if it's plasma, steroids, if it's just a simple block, it really won't do anything, because the issue is structural. It's just like you have pressure on this finger, and I'm literally pouring water on it to try to undo the structural change. So yes, in that particular case, it is a Band-Aid.
It's a Band-Aid because it's just helping with the pain.
Well, it's a Band-Aid in a sense that the structural part of it is not going to go away. It's going to help you with the pain for a little bit and take it from there. Now, that is the foundation of what I'm going to say. Now, if you, which happens in most cases, if you do not have that structural change that is causing the pain itself, right? And it's more likely than not to be inflammation involvement. So at that point, it is treatment, because if you're trying to use whatever medication that you're injecting in there to calm down the inflammation, then that's treatment, because you're taking care of the root issue, right? So at that point, no, it's not a Band-Aid, right? So we need to understand that in certain situations it may be, and in certain situations it may not be. And even when there is a structural change, a lot of the times you may use certain medications and certain injections simply just to carry you until whatever happens. So I've had patients that need surgery, and I don't perform surgery myself, and we don't perform surgery in this office, but a lot of the times we can carry them with a little bit of medication, a little bit of some injections, a little bit of steroids in order to help them with their pain until surgery happens. At which point surgery happens, and we take it from there. Because a lot of people are like, well, we're at a point that we need surgery. Right, you need surgery, but what happens with your discomfort until that day? It might be a few weeks, it might be a month. But aside from anything that is likely surgical, yes, putting the right anti-inflammatory medication in the right place at the right time, absolutely treatment.
So how is inflammation the problem when there's an injury? So if you're saying that that's treatment at that point,
right?
How is it treatment?
Right. So that's a great question. So after an injury, so let's back up a little. So all of us, it doesn't matter who you are, once you hit your late 20s into and on, right? We will always have what we call arthritis, right? Arthritic changes. Arthritis, it literally means inflammation of a joint. That's the exact definition of the word arthritis. And what happens is, with just simply wear and tear, as we go through life, sports, work, exercise, lack of exercise, lack of conditioning, right? They both kind of cause their own type of wear and tear in different ways. What happens is inflammation kind of sets in. It's arthritis, right? We all think some people think, oh, I'm getting arthritis. Oh, did I get it from my mom? Did I get it from my dad? Whatever. It's, some factors of arthritis can be, genetic in sense, but the majority of the case, it's just simple wear and tear. It's just life. It's like a tire of a car wearing. You know what I mean? So now what happens is, because of the structural changes within the joint, because of wear and tear are forming, we create a form of friction, and that friction then creates a type of inflammation. What happens then is the inflammation, after it grows such, it creates micro injuries, right? And those micro injuries then are healed by the body. The issue with the body is that it doesn't heal the micro injuries in a very smooth manner. So instead of me, let's say I'm spackling a wall, right? I spackle it and make it nice and smooth, and then that's the end of it. Instead of me doing that, it's almost like I'm just putting spackle on it. Whenever I feel that micro injury, that hole is full. And then what happens is it creates friction, and then as the friction creates more inflammation creates more micro injuries. Okay. And then those micro injuries in turn create more friction, more inflammation, and creates this vicious cycle, right? And that is how arthritic changes form, how inflammation form. So now let's move back to your question. We all, especially after we kind of hit that late 20s and upward, we all have a small level of arthritic changes in our bodies. You do, I do, everyone in this room and everyone that's listening, more likely than not, does, right? What happens is that our body is able to control this to a certain extent that is not symptomatic. It's not causing you pain, it's not causing you issues. And this is the pullback that I get from the majority of my patients. Oh, but before this accident, I really didn't have any pain. I didn't have any stiffness. I didn't have any pain coming down my arm, numbness, tingling, anything like that. Absolutely, you did it. And the accident did cause this, right? But this is kind of what happens is the idea of you having a small bonfire in your backyard, and out of nowhere, a crazy buddy of yours comes and dumps a bunch of lighter fluid in there. Okay. It creates this really big fire, right? So you had very tolerable inflammation, and all of a sudden this accident happened. That impact and that jerking motion created by a very forceful object, right, now augmented the inflammation to the point that the body cannot control it anymore. That's where medication and proper medication and use appropriately comes into effect and can be treatment to this overwhelming inflammation that the body can just not take care of it alone. Does that make sense? I try to paint the whole picture for you, because that's not to leave any gaps.
Yeah. So, but you were kind of specifically talking about joints as opposed to any other kind of injection. So like you do injections in other places too, right?
Yeah. So we also do stuff like trigger points, straight to the muscle.
Right.
More often than not, the joint is going to seem affected more so than unmovable structures per se. Like if we're dealing with, for example, if we're dealing with this part of my arm, you know what I mean? During an accident, yes, I can hit this part of my arm, and it might get bruised and whatnot. But more often than not, we're dealing with a joint. Now, going back to this part of my arm, or even this part where my forearm is, right? Particularly in the back muscles, but it can happen in pretty much wherever you have a decent group of muscles. You can create different, what we call trigger points. Trigger points, if you ever had a Charlie horse in your life, right? We all have a Charlie horse behind the typical is in the hamstring group of muscles, right? You understand what a trigger point is. You just don't realize that you do. So what a trigger point is a small group of fibers
Mm-hmm.
interlocking, okay, of muscle fibers at that, interlocking and not releasing, not having the ability to relax. Okay, so they contract, they can't come back, and it can be as small as, an inch of diameter.
Mm-hmm.
These are what we, when you go to get your massage, these are the knots that
Right.
the masseuse is releasing. And
Mm-hmm.
simply, what this is a simple physiologic, in a layman's term, behind it. The inflammation underneath that group of fibers, of muscle fibers, the inflammation
Mm-hmm.
right underneath it,
Mm-hmm.
what happens is irritates that group of fibers, causing them to contract.
Mm.
And then what happens is they contract in such a way that they almost interlocked, and they won't give. They just
Yeah.
won't give. You know what I mean? It's almost like if I squeeze my knuckles together and my fingers couldn't pull apart. That
Yeah.
is the idea. And what happens is they want to relax, but the inflammation underneath it continues to stimulate that muscle group, or those fibers, that muscle, not or inhibiting, not allowing for the muscles to relax.
Mm-hmm.
So at that point, we have two things that we got to do. We got to figure out how to release these muscle fibers. You know what I mean? The other thing that we need to do is calm down the inflammation that is causing those muscles to kind of come together.
Yeah.
And these are more often than not the ones that I do outside of that. You know what I mean?
Yeah. Yeah.
The other injections that I do that are not joint related, in a sense,
Mm-hmm.
are bursa injections. We have different little bags of fluid throughout our bodies. We have some in our shoulder, some in our hips, and sometimes they just get really inflamed. Typically, it's going to be because of lack of exercise or conditioning.
But those
Or
aren't in the joint, you're saying?
they're not in the joint. They're actually just outside of the joint. And the typical function of a bursa, that little bag of fluid, is more often than not is the bursa is going to be located right above some kind of what we call a protuberance or a bone bump. Okay.
Oh, okay.
And it's going to sit right on top of it. And the function of it is, as any tendon that goes over that bone slides up and down, that the bursa will keep it from sliding on the actual bone.
Oh, interesting.
And then what'll do is it'll keep it from eventually rubbing that tendon, or that's typically a tendon, right?
Yeah.
From rubbing, to a sense that it gets so inflamed that it can create scarring to that tendon, create a lot of pain. In very small cases, it can even rupture. Unlikely, very unlikely, because the tendon is very thick. But if we're dealing with maybe like an older individual, very old, you know what I mean? It can even cause those kind of issues, but incredibly unlikely. It's just more the inflammation. That friction creates a lot of inflammation and creates a lot of discomfort at times. Okay, so those are other injections that we could do, but more often than not, any injection that we could do, so that we do, okay, should be understood across the board, is that almost every injection that we may do is to calm down inflammation. It's not to help with the pain. We calm down the inflammation, and as a result, the pain gets better. Does that make sense?
Mm-hmm.
No?
Question.
Hey, me.
From Gabby. Random question, but I'm currently preggo. I'm having really bad back pain, and the chiropractic treatment aren't helping. Is there anything you guys can help me with?
That's it. That's a great question. So when it comes to pregnant women, our choices are very limited. Our choices are very limited because obviously we can't use any medication, and any medication that we do use is likely not being tested. So often enough, nobody wants to be that direction. So more often than not, what I will recommend is physical therapy, proper exercises to stretch and condition that area in order to provide that kind of relief. Also, warm compress or cold compress, depending on what's causing the issue, comes into great effect. Depending on what the OB or what the OB allows, sometimes they're allowed for a little bit of Tylenol, okay, which may help with some of the discomfort. But if the underlying issue, as mentioned before, is inflammation, then a lot of them won't allow you to do any ibuprofen. So right, so that can be it's a tough spot. And man, I had a pregnant patient once. She actually had a compression fracture in her lower back, and it was just a tough case. It was a very tough case because it's like, what do you do? And then she, I to be honest, I couldn't even brace her, which is typically what you do on a lumbar fracture. You know what I mean? You put a brace on that kind of helps protect and support that area. You know what I mean? Yeah. Now, some OBs will allow certain narcotics to kind of, certain narcotics to kind of help through that stage, but it would really fall under the OB to
sure.
Yes or no,
So that kind of leads me to our Sorry. So that kind of leads me to my next question, which I wonder if you would be able to do this treatment. What is a PRP injection, and how can it help me after a car accident?
Yep. So PRP, platelet-rich plasma. So let's kind of go over that real quick. So platelets are in your body, in my body. Okay. Platelets are properties in our body that help heal whatever injury we have. Okay. The platelets are, they kind of swim, if you want to say, or they're kind of part of our plasma, and our plasma is part of our bloodstream. Okay. In your bloodstream, whatever is not considered red blood cells, okay, which is those little donut red cells that carry oxygen in our bodies, anything that is not red blood cells is considered plasma. Okay?
Well, what about white blood cells?
White blood cells, if they're in the plasma, they're plasma. They actually would go along into
so your white blood cells are in plasma?
Yeah, well, the white blood cells, you're going to find white blood cells everywhere in the body, but it's typically going to be in the lymphatic system. That's where you're really going to have that bulk of white blood cells. And the lymphatic system, that's a completely different topic. That's more in the immune side of things, Yeah. But yeah, so but you will find white blood cells all over the body. But red blood cells is kind of typically what differentiates plasma versus just blood.
In your bloodstream.
In your bloodstream, right? Okay. And then so let's now that we know what plasma is, let's kind of make it a little bit more practical. So you guys have seen plasma before. When you cut yourself, you kind of develop a little scab, and right around the scab, you see this kind of like almost like honey like gooey substance, and kind of like yellowish in a sense. It kind of like that same color of honey. That is plasma. That is healing properties being brought in by the plasma, by the stream of plasma. And it's understood that plasma is just, it's almost is a stream with a lot of different properties, of which one of them is platelets. Okay. The platelets you have also seen before. When you see your little scab heal up, and you see this almost hair-like structures within the scab. Right. So as soon as I start talking about it, you're like, oh wow, I know that. Okay,
that's so gross.
It's kind of gross, but don't think about it like that. Think about it like right, like we're talking about science, right? and okay, so now we understand what plasma is. We know the platelets and what platelets do, right? So let's talk about it. Along with let me talk about it. Let me talk about plasma. Along with bringing the skin together or bringing the tissue together, whatever it may be,
Mm-hmm.
helps calm down inflammation. Okay, so if you have a bruise in that area, plasma brings the properties in order to calm down the inflammation, help you with the bruise, distribute all the everything that's going on, distribute accordingly to throughout the body, so that bruise goes away, or that swelling goes away, or that redness goes away, whatever it may be. Okay, so so now we know what plasma is and what can it do for your body. Yes. So what we do more often than not, when there is an injury to the tendon, ligament, cartilage, like the menisci, for example, sometimes even in some fracture cases, not often, but it's certain fracture cases, what we could do is we can take a concentrated amount of plasma and just literally deliver this into the injured area, with the hopes that those same properties that our body uses to calm down inflammation and also to heal will be able to do so in that particular area. Now, you can ask me, why wouldn't that be already happening in that injured area if my body has plasma, right?
Yeah.
So absolutely right. That is actually happening in real time in that injured area.
Yeah.
What we can do instead is bring a very much concentrated amount of plasma, dump it in that area, and help the already healing process that is already going be expedited, as well as be more efficient. Right? Is the idea of we're trying to build a car, we're trying to build a house. We have 5 people, and then we bring 100 people to help us build it.
Yeah.
It can't get any more simpler than that. You know what I mean? All right. What else?
So back to the question from the person who reached out. Can you do a PRP injection on a pregnant woman then, if you're basically just taking things out of her?
Okay, that's a great question. Technically, yes.
Okay.
But nobody's tested it yet.
Oh, okay.
All right, and if
so
there
in theory,
it shouldn't.
Like, what's the harm, right?
There shouldn't be any harm, right? And if there is anyone out there listening that knows some testing, Cleveland Clinic or Harbin Clinic or anything like that coming out, please let me know. Please find our number or our email, and please let me know. I love to know myself. I love to understand it myself. But that's the caveat when it comes to pregnant women. Because of the risk, there's been very little studies in many treatments, which is sort of kind of hindering. It's sort of kind of hindering. But at the same time, it's like, why would you take the risk,
right,
and then cause this, right? It's kind of one of those, this can't win whichever way you go. You can't win because you don't have the results, but you can't win because if something were to happen to the baby. Right.
Yeah.
So, cool. But in theory, it should be very safe for the pregnant woman. Absolutely.
Right. Yeah. What is the most common car accident that we see?
Okay. So, very simple. Is rear-ended. Rear-ended. I mean, that is probably, if I see 10 car accident patients today, I would say that probably 8 will be rear-ended.
Wow, so 80%, huh?
Yeah. I would say it's up there. It's very common, and mainly because it's the easiest distracted driver type accident.
Sure.
It's as easy as take your eyes off the road for 2-3 seconds, and everyone's coming to a stop.
Yeah.
And all of a sudden you bump into the car in front of you. The other thing is assuming that the person in front of you is going to go just because the light is green, and before you know it, and the other thing is rainy days. Rainy days bring a lot of car accidents, particularly rear-ended.
Yeah.
I would say that the second most would be something like T-bone. Somebody fails to yield at an intersection, and then somebody's already going, and then you get that T-bone type of action. In the highway, we might get a lot of side swiping. So somebody like turn, going over from one lane to the other, realizing that there's a car there, and then you get that side swipe type of accident. All of them can cause injury. It does not matter how much how the severity of the impact. Let's say you get hit in a drive-through at a McDonald's. You can still have injury from that, and that needs to be understood, because a lot of us, particularly in our field, we're like, oh, but it just happened at a drive-through. There's barely any damage to the car. That doesn't mean that the human being inside of it wasn't injured. You know what I mean? Now, will that necessarily cause like this big herniations that may lead to surgery and stuff like that? Probably not.
Right.
But it doesn't discard or exclude the possibility of injury. Okay.
So once I've been in a car accident and I am injured, would you recommend cold compress or warm compress?
Okay. So I get this question a lot, and what I try to do is kind of educate the patient more in how each cold or warm help the body in that particular situation. Okay, so let's talk about warm for a second. Okay, warm helps the muscle fibers relax, right? So if we're having any tightening in our muscle fibers, and it's very palpably noticeable most of the time, warm would definitely help you more. Okay. And it's as easy as kind of like reaching in your back or neck and understanding that there is a lot of tightening. Sometimes the muscle will literally tighten to a certain extent that it causes what we call hypertonicity, meaning the muscle itself grows as if you were lifting weights almost. But it's because the contraction is so intense that there is growth to the muscle, and there is more blood flowing into the muscle, making it that much bigger. The body's really trying to help the muscle and the area by bringing more blood, more plasma, as we discussed earlier. Remember that in the bloodstream, there's always plasma. But what happens is with that volume, it makes the muscle grow, and it causes almost like increased pressure, which causes increased pain, increased irritation, and then it creates this kind of vicious cycle. Okay, but definitely warm will help out relax the muscle. Right, cold helps mainly with inflammation. So think cold water calms down fire. Think about it like that. Right. And the issue becomes is when you have both, because often you will have inflammation irritating the muscle fibers, leading to different muscle or trigger points, or even a Charlie horse, right?
Yeah.
And then at that point, this is my response to the patient, and by any means, if anyone out there has more studies about this, but this is how I take my approach. At that point, obviously, I'll give them some medication, prescription medication. Typically, it's going to be some anti-inflammatory and muscle relaxant. But at that point, I tell the patient, do whatever makes your body feel better. You know what I mean? It might be that warm helps more than cold, then do warm. You know what I mean? It might be that cold, do better than do cold. That's fine. Because the hope is that our treatment is not going to stop at warm and cold compress. It's probably going to involve some conservative care in the form of chiropractic care, physical therapy, oral medications, injection type of medications, and that type of thing. One misnomer or myth that I want to kind of make sure I talk about is when it comes to injection. I know we talked about it in the past. Is when it comes to injections, a proper administered injection with proper numbing medication and proper technique should really not hurt. Might be uncomfortable a little bit, but it should not be painful. It shouldn't bring you more pain than what you already have. Okay, if that has happened to you, then the injection was not properly administered. I would say that probably 99 to 100% of my patients, they freak out at the idea of injections. And the girls are can be my witness, because they go in with me with every injection. After the injection is done, most of them, or a good chunk of them, don't even know that I'm done with the injection. It's that quick. They don't even know that I was in and I was out, right? So a properly administered injection should really not be painful or very small discomfort, if any. And it should definitely not cause more pain than what the pain that you're already in. Okay. And the results should be noticed within hours, 2 or 3 hours at most. Okay? All right. All right. What else?
So once I get better from my car accident, will my pain come back?
Yeah. So that depends. That really depends on the injury. That really depends on the injury. But rule of thumb, most of the time, is if we can get you better from the accident, if we can get you to the point that you're a baseline, you may have some discomfort here and there, that's fine, but nothing that a little ibuprofen or Motrin can, kind of like a headache kind of thing, can deal with. But rule of thumb is, if we can get you better, unless an accident of the same force or greater force happens, you should be good to go. You really should be good to go. Okay. Now, in times, depending on the injury, if the injury is severe enough, particularly in the joint, it can increase the probability of arthritic changes. Okay. Which it can increase the wear and tear rate in that joint. Okay. So when your joint is 20 years old, when the accident happened, and the joint is the arthritic changes in the joint, let's not say 20, let's say 25, 28, and the arthritic changes or the rates in the joints are moving accordingly in almost in a very parallel way, a parallel fashion to your age. If you do involve a car accident that affects that particular joint, it'll cause that joint to age faster when it comes to arthritic changes and wear and tear changes than that of a patient that would be of the same age or without that accident.
Right.
Sure. I mean?
Yeah.
Right.
Yeah. So after my car accident, then what kind of medication should I take? Assuming that I can't get to a medical provider immediately.
Yeah. Okay. So it's a good question. And the answer is very simple. It should easily be assumed that any injury, particularly of a car accident or a fall, or will cause what we call acute changes, which is changes that have happened. The difference between acute and chronic is 3 months. That's really what it is, right? 3 months. So if you are within that window of 3 months, you are considered an acute change or an acute injury, right? So now we're within that window. It should be very safely, very educated, assume that the inflammation will likely grow from the moment of the injury and forward. So what do we do with inflammation? We want to calm it down. So a simple regimen of anti-inflammatory medication, such as ibuprofen, Motrin, once to twice a day, with food. Always make sure, particularly anti-inflammatory medication, definitely antibiotics and anything else. Just make it a rule that whatever medication you take it with food. It's just easier on your belly. Start a regimen, and that alone should help out. I have many patients that I just treated with oral anti-inflammatory medication, We don't end up doing any injections. Chiropractic and physical therapy very short lived. You know what I mean? Because we are thinking about about the inflammation as how we should. So the inflammation should be treated almost as if it were an infection. When we have an infection, we treat the infection until it's gone. We do it very similarly to that when it comes to inflammation. Now, I think I have like 2 disclaimers. One, anti-inflammatory medication will definitely but can irritate the lining of the skin of the stomach. Okay, so if you are a person that takes anti-inflammatory medication on a regular basis for whatever reason, headaches, back pain, whatever, do understand that this is more likely than not irritate the lining of your stomach more so, and it can create an ulcer. Okay. So in that particular situation, I would definitely make sure, in any situation, but this particular situation even more so, make sure that you consult with a provider that understands this medication to its full extent and the injury to its full extent, to make sure that things are going to move appropriately and not create another issue trying to fix another issue of one issue, right? So another medication that I like to use is a simple muscle relaxant, but that would be prescription medication. You definitely have to see us and be evaluated and see if that kind of fits your case. Right. But just doing a little bit of anti-inflammatory medication helps greatly. Yeah. Another thing that I like to do is very very acceptable to combine a little bit of anti-inflammatory medication like ibuprofen with a little bit of Tylenol. Tylenol will help with the pain. Ibuprofen will help with the inflammation. And then boom, you kind of kill the 2 birds with 1 stone. Something that we need to understand as a whole, right, is that inflammation. This is what I'm trying to get at. We often go after the pain, right? And it's our immediate response. It's like, oh, I have pain, let me do this for my pain, right? Right. Instead, what I would love to teach, if there's anything that our public takes from our talk today, is we need to go after the inflammation. We need to go after the cause of the pain, because we can take Tylenol until we develop a liver crisis and never get better, right? The same thing with anti-inflammatory medication. If it's not helping, there's definitely an issue that is greater than that, right? Yeah. And we can take anti-inflammatory medication to help with the pain as much, we can, to the point that it develops an ulcer in our stomach. But if we don't treat the inflammation, the underlying issue, whatever that may be, I just say inflammation because it's more often than not the case. We're doing ourselves a disservice. We're not understanding our body adequately. Okay. What else?
So, how do I prevent my pain from coming back after a car accident?
That's a good question. So this one is not going to come to a shock to anyone, but proper exercise, proper strengthening and conditioning exercises. Okay. The majority of the time, there is a joint involvement and there's a muscle involvement when it comes to even after a fracture. After you get a car accident, a fracture happens and then it heals, and you still want to do proper exercise. A lot of the time, not a lot of the times, but it might be that you need a physical therapist to help a physical therapist to kind of segue you back into that active lifestyle, that you do conditioning and strengthening and moving in that direction. But it's very simple. Once I say it, you're going to get it and it's going to make complete sense. Okay. So the muscle is supposed to support our joint and bone. Yeah. When we take away that strength, what happens is that now we're dumping all that weight onto the joint. Yeah. And then the joint was never supposed to support us. Right. It's simply supposed to provide that functionality in movement. but that was it. That was it. The support comes from the muscle. When we lose that muscle girth and strength, okay, we are putting all that weight and all that force on our joint. And then that will, yet again, coming back to increasing the rate of arthritic changes, that will increase the rate of arthritic changes, making the 1H joint now look and feel like it's a much older age.
Yeah. What happens if my accident causes a herniation?
Okay, so let me draw two circles here real quick. So in order to understand, and then I'm assuming that we're discussing a disc herniation. There's many herniation. A herniation is when any particular structure protrudes through another structure. So when we're talking about abdominal herniations, literally our small bowels protruding through a weak spot in our abdominal muscles. Okay, that's what you get. And then you have different types of umbilical herniation and inguinal herniations, and all of those are pretty much the same thing. You know what I mean? And it can happen in different organs and whatnot. But if we're talking about the spine, the spinal column, and we're referring to a disc herniation, still same concept happens. There's one inner structure that protrudes or squeezes through a particular structure. Okay. So now I made two circles here. I don't know if I can, it looks kind of funky, right? But so the inner part of the circle in this particular case, so the full circle is let's call it a disc that goes in between each vertebrae.
So the outer circle.
Was that the outer or the full circle, right? Or the full structure? Let's just say that.
Okay.
All right. Now,
okay.
The inner part of the circle, there's two circles. There's the inner part and then there's the outer part. The inner part of the circle of a disc is like a little bag of fluid. Okay. And it's like a little bag of fluid and it's very normal there for the body, and the body has created it to create this almost this shock absorbing functionality to the disc itself. Okay.
So am I looking at like a cut of the spine?
Right. So you're looking at a cut on the spine. If I were laying
horizontal cut through the spine, and then I'm looking down into it.
You're looking down.
All the nerves and stuff like that would go through that center.
That's a completely different conversation. The nerves would actually be in the back somewhere. Okay. Out. Okay.
So your spinal column doesn't hold your nerves or anything like that.
Your spinal column does hold your nerve, but not the disc.
Oh, okay.
Right. Not the disc.
Got it.
So the disc itself is just simply a little cushioning pillow, if you want to call it, for each bone not to crash against the bone below it.
Right. Okay.
Okay.
Sure.
Otherwise, with the one bone above, the one bone below, if it were anywhere separate, and you would jump from 3 stairs onto the floor, they would crash on. They would crunch onto each other. So that's what the disc prevents from doing. It just protects each bone from the one above and the one below. Okay. Now we have a disc. Okay. Those are all great questions. Keep asking me more questions, because I want to make sure that that you as well as the viewer kind of understands this. So we're going back to the herniation. We have the inner part, which is a little bag of fluid. The outer part, the outer donut, if you will, is like a thick cartilage. Okay. Like just like the nose or like the ear, maybe a little bit more spongy. Okay.
Okay.
What happens is when there is any advanced pressure applied to that disc, part of the inside of the disc can squeeze out. Okay. Squeeze out, kind of like we were talking about, like the abdominal hernia, right? And then the inner part of the disc, okay, can actually cause a bump, and that bump is what we call a herniation. Okay?
You should get that little model.
I know I should. I'll get it on our next talk. I'll get more models out, and then we can talk about the structure, because I feel like it's important to understand the structure when these questions are asked, because otherwise it's just a random bunch of words. It's kind of hard to make sense for that person that never studied this kind of science.
Yeah,
right?
absolutely.
So now we know we're talking about disc herniation, and we understand what a disc herniation may be. If that bump that is squeezing out through the disc starts to put pressure on any nerves or the spinal cord itself, it can be very detrimental for the patient. It can cause a lot of discomfort, numbness, tingling, pain coming down the arms, pain coming down the legs, all of that stuff. But the question, what happens if the accident causes a herniation? The easiest answer to that is that if we treat the inflammation and the herniation shrivels over time, okay, the body itself will take care of it. Okay. Now, sometimes the herniation won't shrivel. Okay. There is and I'm talking about shriveling. So there is a very common phenomenon called disc desiccation, which stands for drying out. That's literally what it means. Desiccation just means drying out. So then the disc, what will happen is that not the disc itself, but the herniation, the little bump that is protruding through, okay, my knuckle, will literally dry out to what almost like what a grape is to a raisin, or vice versa. Okay, so it'll go from a grape, so a very full disc, and it'll dry out into a raisin. And the hope is that if the disc is shriveling in such way that it will no longer put pressure on any nerves, causing the discomfort. Okay, if this happens and there is a hernia, which is typically what happens, I would say in the vast majority of cases, probably in 70 to 90% of cases, okay, then there's not much to worry about when it comes to a herniation and an accident.
Yeah.
Because even though the injury happened, now the injury has healed, and there's no actual pressure on the nerves of the spinal cord, putting you at risk of surgery.
Right.
Okay. All right. And then all we have to do at that point is treat the inflammation.
Yeah.
Okay. So that is pretty much the risk of herniation. But it is, and I will say it shouldn't. People should not necessarily freak out when they hear the term disc herniation or herniation in the spine, because it's very common. It's very common. If we were to scan, well, the true way of understanding whether there's a herniated disc present is by getting an MRI. Okay. All right. And if we were to scan 10 people of, past the age of 25, probably into late 20s and up, or let's just say mid 30s for just across the board. If we were to scan 10 people, I would say that about 8 people of those 10 would probably have some kind of disc herniation, at the very least a small herniation. So it's very common because of just simple wear and tear.
It just doesn't always cause pain.
And it doesn't. That's a great point, okay, that you bring up. Disc herniation does not automatically mean that you will have pain from the disc herniation, because the opposite is true. I have patients that have a positive disc herniation under MRI, and they have back pain, let's say that, or they have neck pain, and the MRI of the lower back is positive for a disc herniation. But then I tell them, and they're surprised by it. But then, because I tell them, hey, yes, you have a herniated disc, but pain is not coming from your herniated disc.
Right.
And it's not uncommon to have that phenomenon. And you need a experienced enough provider to understand the difference of the two, because you might be chasing the herniation, trying to treat the herniation, and trying to treat the area of the herniation.
Yeah.
When to treat the back pain or the neck pain.
Yeah.
When the pain, what we call a pain generator, might be to the right of it or to the left of it. You know what I mean?
Yeah.
Or above it or under it, right? Very important for us to understand that in order to identify what's really causing the pain, because otherwise you can treat that area until you turn blue and you'll never get better.
Awesome. Well, that is our time for today.
Awesome.
Seems to always fly by, but that was so much great information. Thank you so much.
Cool.
If you were not able to join us today for our live session, don't worry about it. The recordings are always available on our Facebook page, YouTube, and Instagram.
Awesome.
If you have any further questions, feel free to contact us via our social media page or give us a call to the number on your screen below. Don't forget to join us next Tuesday at 12 on Delta Orthopedics Space page and YouTube channel. Have a great day.
Awesome. All right. Thanks a million, Amanda.
Yeah.